Well, back and spinal pain can be a serious problem, and relief isn't always easy to find. Here in Austin, we're lucky to have our friends at Advanced Pain Care who offer neurosurgery services for pain relief. Dr. Sean Moore is a board-certified neurological surgeon with 15 years of experience caring for patients, and he has an extensive background in minimally invasive spinal surgeries. Not to mention, he also holds several patents in minimally invasive lumbar spinal fusion technologies. Good morning, Dr. Moore.
Good morning, Stephanie. How are you?
I'm excellent. That's quite the resume you have there. It's great to have you on the show this morning, of course. Now, can you start by telling us what minimally invasive spine or MIS surgery is and who's a candidate for MIS surgery?
Yeah, that's a great question, Stephanie. So minimally invasive spine surgery, or MIS for short, has been around for the last 10 or 15 years. It kind of rose to prominence in the early 2000s. And I was fortunate enough to be exposed to those techniques early on in my training when I was at UT Southwestern in Dallas. They've only grown in technology and expand since then, and now we can apply them to many different patient populations that we couldn't in the initial phases. It basically means that it's just smaller incisions, smaller exposures. So in the past, when surgeons did lumbar decompressions or fusions, they often required large midline exposures and muscle splitting techniques because they were using overhead lights or headlights, and it was difficult to visualize the neurological structures. With MIS techniques, you're basically putting small tubes, channels, or ports into the spine, so you're only dilating a small portion of the skin, the muscles, and the other soft tissues around the spine. So it's less invasive on the opening and closure. The actual decompression and fusion portions of the procedures are very similar, but it does save operative time because it's so simple to expose these patients and to close the incisions. And now they have much smaller incisions, so it's just overall quite a bit less invasive for the patient.
Okay, so can we go just a little bit deeper in the benefits of MIS surgery over traditional open techniques then?
Absolutely. So with traditional open surgeries, the surgeons often make several inch incisions. So for the average lumbar fusion, you might be looking at an incision that's 5 or 6 inches. Those patients are often exposed to anesthesia for 3, 4, sometimes 5 hours. They're often in the hospital for 3 to 5 days. With an MIS lumbar fusion, you're looking at an incision that's 1 inch or even a little bit less than that. The operative time averages an hour. The blood loss is minimal, and the patient's actually discharged from the hospital the same day. On the long end of the recovery spectrum, they can often return to work in 3 to 4 weeks. They're often 100% by 6 to 8 weeks. And that's much faster and much more favorable than open techniques. So you're basically looking at less tissue disruption, smaller incisions, shorter anesthetic times, less blood loss, shorter hospitalizations, which equates to less complications, less infections, earlier return to work, and earlier healing. So overall, I think they're far superior to open techniques, and they're kind of becoming more and more adopted, particularly in large cities where they're becoming the standard of care.
Wow, okay, so a lot of benefits there. Now, Dr. Moore, can you tell us what types of conditions neurosurgeons treat?
That's a great question. And neurosurgeons treat, not only spine, but also brain, which is a little bit outside the scope of our discussion here today. But as far as the spine goes, we treat, often patients have herniated discs. They often refer to that, as pinched nerves or conditions that cause sciatica, pain down the leg, numbness or weakness in the leg. We'll treat spinal fractures. We'll treat degenerative conditions of the spine, like arthritis of the facet joints, spondylosis, deformity. There's all different things in the spine that we can treat.
Great information, Dr. Moore. Thank you so much for being here with us today. We'll talk to you soon.
Thanks, Stephanie. I really appreciate it.
Absolutely. Now you can learn more about minimally invasive spine surgery at Advanced Neurosurgery by visiting their website, austinpaindoctor.com.